3, 2, 1. There we go.
Is that the start? So, this is our first attempt at a podcast type video, and today's topic is Invisalign. Hot topic for you.
Yeah, because I'm thinking about getting it.
Yeah, so if we start off the bat with what made you think about Invisalign?
Well, I had braces when I was like 15 and 16.
Did you? I don't know if I knew that.
And then I got them off and I got given a retainer. And I was told if I wore the retainer for like a year minimum, they would be fine.
Yeah.
And so at a year, they broke one of the nights I put it in my mouth. I must have just bit down something and the top one snapped.
Yeah.
And my parents were like, well, he said a year.
Yeah.
So I didn't wear them. And then these front 4 teeth like drifted back to what they originally were.
That's such a classic scenario. Like, so my dad is a dentist, as you know, and I don't know what I was told, but to be honest, I think I finished my braces when I was a teenager, and the orthodontist said to me, you've got to wear it every night. And I think I asked him how long, because all your mates at school are like, oh, you've only got to wear it every night for like a year, and then you can wear it like once a week. And it's like all like I'm sure a friend told me that, so I asked him and he was like, yeah, it's probably fine. But in reality, I see all the time people like me and you, most people, things start to move eventually. Now, my dad's teeth, my dad never had braces, doesn't wear a retainer or anything, and aged like 50 something, his 2 front teeth at the bottom just started going like that. So like now, rightly or wrongly, my approach is like, I feel like if you want your teeth to stay where they are, everyone should sort of wear a retainer, because otherwise you get the problems that So I did Invisalign on myself because my teeth moved back.
Yeah, I would quite like to get it done. I hate these front 4 teeth, they really bug me.
I think it would make a massive difference to you. That's what I said to you before, like, so for the record, Andrew has very nice teeth. Zero fillings?
Zero fillings.
Zero fillings. Straighten those front 4, I think you'd be made up with it, because I don't think it's that complicated. And that's the good thing about, I'll tell you what I think Invisalign is the perfect situation for, or one of the perfect situations for, is what dentists call ortho relapse. So orthodontics relapse, like move back. Like, because generally the movements aren't too major, so you're not going to need like wires, like elastic bands and crazy stuff.
Yeah.
So I think it would be perfect for your teeth. And this isn't me trying to make a hard sell on Andrew, because I'm not going to charge him to do it. So
that was camera that you said you're not going to charge me. Three
cameras, but you are paying the lab fee.
Yeah.
Otherwise, I'm giving you a very expensive gift. Maybe I should be doing that, but no, because then everyone would want it.
So I've been looking up today, because I knew we were going to be talking about it, some sort of like frequently asked questions. I guess from people that have been going to get Invisalign treatment, and you know, obviously this is more targeted at dentists, but it could just be useful for them and how you answer those questions.
Yeah.
Because the main one seems to be like, what is the difference other than like cost between sort of your traditional metal braces and a retainer?
Yeah, I think talking about patient questions is interesting, because a lot of the people who seem to watch our videos are maybe younger dentists and people who might not have done an Invisalign course, or might be thinking about doing it and thinking, is it worth it? And wondering what people ask. And so over the past however many years, the sort of questions that I've got asked are that sort of thing. And in terms of the difference, I think, so do you want me to say what the differences I think are, or what?
Yeah, like if somebody asks.
Well, I think the obvious one is like that you can't see it. like Invisalign, or there's loads of different. You might not know. You might know. There's loads of different clear aligner makes. So Invisalign was like the first big one. They're like the Apple of the market, and they have this like monopoly. But people are starting to come in, making like knockoffs or whatever, which are a lot of them are good apparently. I've only ever used Invisalign. But yeah, the obvious thing is in the name and that you can't see it. So I mostly treat adults. I don't see a lot of kids as patients. So most adults don't want a wire brace on, I think. Like you, for example, how would you feel about wearing 12 months of like top and bottom wire brace?
Yeah, I wouldn't like it, to be honest.
Potentially, I reckon enough to not bother with it.
Yeah.
Don't know, like maybe a push if you really hated those front four, but and then they had like these internal braces, so like a wire on the inside. I don't know how much they do that on the top. You see it a lot on the bottom, I think, but then there's this Invisalign. So that's the obvious thing. One of the other differences that is, I think, a big factor is that people take it in and out, that's removable. And I think that is potentially, like it has to be that way because you can't have your dinner just like stuck in it and trying to eat with it. But it's potentially a bad thing in some ways because it changes massively, the result changes with compliance of the patient. So if Andrew starts Invisalign and Andrew likes eating chicken strips at 11 a.m. and then forgets to put them back in until 5 p.m. every day or whatever, like it relies on, so each aligner is a slightly different shape and it supplies like a small force on the teeth that each one is different and it slowly, with that force, moves the tooth. If your teeth aren't exposed to that for 22 hours of the day, it's not going to work. And I've had the scenarios where there's a group of people who come back and they'll be like, yeah, I've been wearing it, look, I've got it in now, and it's like halfway off their teeth because they haven't been wearing it and they're just sort of trying to make the point that they have. And so compliance, whereas when it's a wire stuck in your teeth, one problem is they might not brush their teeth properly, but at least they can't take it off and leave it off.
I always wondered that because you know they have like I don't know what it's made of, but like this looks like plastic bits. How do you actually?
With braces?
Yeah, how would you have kept that clean? Because that covers quite a big.
Like the wire brace?
Yeah.
So, I mean, in terms of maintaining teeth with a wire brace, or what, like a fixed brace, what we call it, the tips that I give people are, so they make specific toothbrushes and stuff for it, but like essentially brushing above the wire, below the wire and on top of the wire. And then the problem is like getting stuff out from in between, so maybe use like a little brush. The actual bit that's bonded to your tooth, because it's sealed to the tooth, is probably not much of a problem.
Right.
But what you do get is around the edge of that, people get the brace off, and either from stuff getting stuck around the edge of that or in between two bits, they get like these white spots.
Yeah.
So a little while ago I had to fix that for a teenager who hadn't got stuff stuck around his brace and hadn't got it out enough. So then you get these like white spot lesions or like early caries, decay, like on little areas at random places like on the front of the tooth where you wouldn't normally get it. And you get that less with Invisalign. I think one of the problems with Invisalign is, so often we do this thing called IPR, we'll probably have to do it on your teeth, which is where you shave a fraction between the teeth to give space. So one of the analogies that I give is if your teeth are like a row of parked cars, like bumper to bumper, you can't move them, they're like stuck. But if you give a little bit of wiggle room, you can get them where you want to. It's not seen as dangerous. Often patients ask, like, is that safe? It's such a small amount that it's seen as okay. But yeah, when you make those little gaps and then people are taking retainers in and out, and if they're not cleaning between their teeth well, then they'll have a bit of their sandwich still stuck in between two teeth and put the retainer back in, or the aligner, I guess it's supposed to be called. And like, then my worry is that at the end of the treatment they'll get decay like in between two teeth.
Right, okay.
Because they haven't cleaned between them. So sometimes, in terms of differences, sometimes people say, like, I think it's true that fixed braces are probably more adjustable. You can do a bigger variety of things. You can probably do more complicated things. Although there are people out there, not that I do this, because I generally just do fairly straightforward stuff, but there are people out there who will say with clear aligners that you can do really complicated things with people's teeth.
Right.
And you probably can. It probably depends on the dentist and how they're doing it. But generally the fixed braces are good for complicated things. Some people might say that it's potentially quicker, although, you know, I'm not an orthodontist, so getting into the details of like the very specific stuff is probably like out of my remit. But yeah, I think clear aligners are really good for like straightforward things, and that's what they're probably mostly used for.
Yeah, it's like cosmetic more than
function.
I don't know if that's really like reductive or
no
to describe it, but
although one functional reason which I think Invisalign does work for is sometimes you see people with really worn down teeth, so their teeth are like little flat things because they've got this bite where their front teeth just like smash together.
Yeah.
So what I've used Invisalign for quite a few times is to like pull the bottom teeth in and keep the top teeth where they are, or rejig them a little bit so that the bite, instead of the teeth slamming together like that, so you have a little bit
like an artificial sort of overbite.
Yeah, like
I guess not artificial.
You do, well, I guess like it becomes a bit of an overbite or overjet, so that basically there's some separation, so you can fix the teeth where they're worn down and then maintain them like that, and they're not just getting smashed into like constantly every day. So that's Invisalign used for function, but there is a cosmetic element. There's a roundabout way of answering.
I thought that was quite a good answer.
Okay.
Do you want me to ask you another question, or?
I'll ask you one, just because I feel like I've talked loads.
That's enough on
So what I was going to ask you is, as a patient getting Invisalign treatment done, what like puts you off, or what are you worried about being a problem, or?
To be honest, I'm not actually worried too much about like anything like that. I think the only thing would just be like making sure of keeping the retainer clean and basically not putting in money and effort into it, and then it all like kind of just goes back to normal. What was the wording of your question again?
So like, what things, going into potentially having that treatment done, what things are on your mind as like things that you're aware of or concerned about being a problem?
Well, these, I don't know what you'd call them, the two
lateral incisors.
Those. I've always had trouble with them, so when my baby teeth came out, these grew
like
up here, but they didn't come all the way down, and you know, this, I think it was this one on my right side, was nearly all covered in gum.
Okay.
So the orthodontist, before giving me braces, had to scrape away a lot of gum and like physically, I think, pull that tooth down a bit to get the braces on to So those have always been sort of problem teeth, so I'm just kind of worried that they would continue to be a problem.
Yeah, it's like your body was made to have those teeth
up
like
there,
that, but we don't want them there. Yeah, I think the teeth which everybody notices the most tends to be the front four at the top.
Yeah.
And if you can get those nice and symmetrical, generally people are pretty pleased with their teeth. So I think yours probably, if you've never had the first brace, it'd be way worse. But
Yeah.
yours is still slightly forward and slightly higher maybe than your front teeth. So if we pull those in and down a fraction, so like that, and then your front teeth, straighten them up and maybe pull them a fraction forward so everything's in a line.
Yeah. So it does kind of feel like one of my front teeth probably doesn't, but
It looks like it's on a slight.
It is on a slight, but it almost feels like if I run my tongue behind it, that it like curves, right? And then it might not, it might just be in my head.
I mean, the back of the tooth it tends to have a bit of a curve, but
I'm feeling them now and I'm like, thinking about it.
Me too, mine feel, there is a bit of a curve on the back of the tooth, but
yeah, that would be the only thing really I would be worried about, is them sort of continuing to be an issue.
And I think if those teeth have always been the biggest problem, the likelihood is they probably might be the hardest ones to move.
Yeah.
Because they might be the most stubborn and they need the most movement and stuff. But it's very, well, put it this way, when you had the brace, were they straighter than they are now?
Oh yeah.
So we probably have the potential to get them back to how they were.
It did used to be like perfectly straight, and then just by not wearing the retainer, they just drifted forward.
Yeah. So that's potentially a good topic. Two things. First thing is, you said you're worried about keeping the retainer clean. People ask about that, and people ask what to clean it with. And to be honest, as a dentist for a while, I probably didn't really know what I thought, because you don't really talk about it loads. So there's these retainer tablets that you put in a glass of water, whatever. Cleaning it with a brush. People like, do I need toothpaste? I don't say you need toothpaste. I think like soap and water can work. But nowadays there's these retainer pods.
Yeah, I've seen those advertised. I think we even did a video about
we did. So a local guy started a company selling them. Those ones are called Opulus. And I've got one from him, and we sell them here. Support local, but I'm using his one at home, and I've just got a new retainer, and it is actually really good, because you just whack it in there with some water and stick it on, and they so far feel like completely clean the next day. And they're like, his ones, they're like 70 quid, and I reckon it's probably worth it. The most well-known company, they're probably like 90, £100 or something. And then I had a patient in here the other day who was like, what are they called? And he looked it up on Amazon in front of me. I mean, I'm not bothered. We're not here to like sell retainer pods or anything. We just have them for convenience for people. But and there's like a 30 quid one.
Right.
And then that's probably crap. And I had a really smart patient come in. This guy who's like, you know, some people are just really clever. Like this guy's just like a bit of a genius, and he's a teacher, and like you just know that he knows what he's talking about. Really nice guy. And he bought a retainer pod, and he said, "Oh, I did a test to check it was ultrasonic." I was like, "Oh, nice. What do you do?" And then, to be fair, I have heard this before. I don't know if you've heard it. Like, did you do science like later on in school?
Only to like GCSE level.
So he said he just got a piece of tin foil and put it in the ultrasonic pod. And it's true that ultrasonic, like true ultrasonic, makes holes in tin foil. Yeah, I forgot that. I did know it, but I forgot it. And I was like, you legend. And he said that the one he bought did. I don't know which company he bought. But I should test my own one. But that one I think is ultrasonic, because if it's getting to like 70 quid, it will be a proper one. But so keeping it clean, I actually think those ultrasonic pods are really good. And I think it's worth 70 quid. The other thing that dentists often wonder, if they're starting to do Invisalign for people, is the whole topic of do you give them a retainer only, a removable one, or do you put a fixed retainer? So like the wire that's like glued to the back of like the front 4 or 6 teeth. And I don't know, in dentistry a lot of it is like opinion, and different people will teach different things. It depends on who taught you. So the person who taught me said that he didn't really like fixed retainers. He generally just does removable ones. And if the teeth are particularly stubborn, every time that you put in the retainer back in, it feels like just in that one day the teeth are like constantly trying to move back. Those people may be both fixed retainer and removable. That's because a fixed retainer doesn't necessarily stop your teeth from moving.
Yeah.
People can have one of those. I've unfortunately somebody I'm seeing at the moment who just had braces, had a fixed retainer put on, didn't wear his removable one, and the teeth have started to move a bit. So nothing generally is quite as good as the removable one, but I guess the ultimate is maybe both.
Yeah.
But I also, possibly as a result of the way I've been taught, don't like the fixed ones because they're a nightmare for people to clean behind. So I wouldn't choose to give one to you unless we needed to.
Yeah.
Because otherwise, for the next however many years, like you constantly, it's just such a pain trying to like floss your teeth or get a little brush under the top of the bar.
Yeah.
So personally, I just like the removable ones.
Yeah, well, those are probably the ones I'll go for.
Yeah.
They sound the best so far out of them.
I think it's the easiest. So this was I don't know where to look. So the camera's on the go.
I would look at the middle one.
So this was a test of, I'll start again. So this was a test of this sort of format, talking about topics which people might find interesting, I guess, a sort of podcast style, although, you know, there's a bit of hate people get for everyone trying to have a go at a podcast these days, but someone might find this interesting. If you found it interesting, please subscribe to our channel, give the video a like, let us know topics you might be interested in, and ultimately we're here trying to make videos which will be just helpful for somebody to watch or listen to. So thanks for watching, and see you on the next one.